Hello students, welcome to Distinction Learning Platform, and on this platform you find revisions, explanation to difficult topics, tests, a lot of stuff. So before we begin our lessons, make sure that you subscribe so that you can be updated to upcoming videos. To make the story short, let us begin. And don't forget to like the video, okay? So in this video, we're talking about what? Question 2. Remember that there was what? Question 1, and now we talked about APH, question that can come under APH, okay, on how you can approach APH, stuff like that. So make sure that you watch from the playlist under OBS and GYN, okay? So question 2. So let us now try to analyze this video or this question. Remember that the moment we go to a certain question, we are going to make sure that we come up with a correct diagnosis, because if we fail, or if you fail to find the correct diagnosis, you are going to find out to say all these questions that are under here, that you are going to fail them, okay? Basically, you are going to get what? 0 marks. So make sure that you find out the correct what? Diagnosis, okay? So now let us try to find out this correct diagnosis. How? That's a question that you can ask. So, okay, before going any further, let's go to the question. Okay, if it is not clear, make sure that I'll be reading it so that you hear whatever the case is all about. Okay, Mrs. Vivian Chanda has delivered a 4,100 gram baby in your labor ward. Okay, she was given oxytocin IM intramuscular by the delivery midwife. Okay, however, she has continued to lose blood and so far has lost about 2,000 mils, okay, of blood. You have been called to see by the midwife because of this blood loss. What is the diagnosis of this patient? Okay, so that's the first question that they're asking us. Okay, now what are the main things that you need to talk about here? What are the things that can lead you to the diagnosis that you need? Okay, there's something that is really important here. They are saying blood loss. Okay, there is blood loss here after delivery. Okay, blood loss. So that's the key thing that is there. Okay, after delivering this baby by Mrs. Vivian Chanda, then basically Mrs. Vivian Chanda started losing blood, even if despite giving her oxytocin, okay, but he continued to bleed like that. Now the question that you can ask yourself to say, okay, what are the conditions that can lead to blood loss? Okay, there are a lot of cases that can lead to blood loss during pregnancy or after pregnancy. Okay, so but during pregnancy we talked about APH, and also maybe ectopic pregnancy, and as well as gestational trophoblastic diseases. All those, they can cause bleeding, but during pregnancy. But after delivery, then it has to be something else. So this is after delivery. So after delivery, there's just one condition which we call postpartum hemorrhage. So what are we saying here? So the most likely diagnosis you should be PPH. But again, you need to understand something. PPH is not a diagnostic thing that you can put just like here my diagnosis is PPH. PPH is not a diagnosis. PPH is syndrome. Why am I saying so? Because PPH is just a syndrome that has some certain cause. If you find out the cause, now basically that is your diagnosis. So PPH has to always exist secondary to something, because PPH is is a syndrome. So what are we saying here? We're going to say, okay, it's postpartum hemorrhage. You're going to say PPH, but you're going to say secondary, like that. Secondary to what? You go here, you come here. Secondary to what? So remember that they are saying Mrs. Vivian Chanda has delivered a 4,100 gram baby. Basically, this is a large baby. Okay, large baby from OBS and GYN, we call it macrosomia. So the reason why this patient is bleeding so severe, because she gave birth to a larger baby, a big baby. Okay, remember that the normal weight of the big baby should be maybe around maybe around should be 3,000 grams there, or 3.5 somewhere there. Okay, that's a normal, but basically it has to be less than 4. Less than 4 years, that is normal. And greater than 3, that is normal. 3 to 4, that is normal. Okay, less than 3, abnormal. greater than 4, abnormal. Okay, so the reason why someone who had PPH, it was because of what? Macrosomia. Okay, so we can say PPH secondary to what? To macrosomia. Okay, big baby. So let's ask for you to remember, we're saying big baby. Okay, big baby, like that. Okay, now since we've talked about the diagnosis of this patient, so always you can see PPH secondary to what? Macrosomia. That is, it should be the correct diagnosis. Okay, now question B, they are saying define the condition the patient have. So there has to be have here, has, the patient has, and how do you classify it? So they are talking about now this condition. The condition that we are talking about is what? PPH. Okay, but this PPH is always secondary to what? Macrosomia. So how can we define what? PPH, and how can we classify PPH? Come here. Okay, so how can you define PPH? And the thing is, if you are defining something under OBS and kind, make sure that you give a lot of definitions, because if you just give one definition, some doctors, they are not going to accept it. Make sure that you understand that. Okay, there are some, like let me give you one good definition of this. So the first definition that you know is that we know that it is what? Blood loss, or let's just say bleeding. Okay, bleeding. If you talk about bleeding after, so we're saying this is always bleeding after what? Delivery. We know this one. Okay, bleeding after delivery. Then how much blood loss are you going to lose? Okay, that's according to the amount of what? The blood loss that you are going to lose. Okay, so bleeding after delivery, that is PPH. Okay, now per vagina. So how much blood are you going to lose per vagina? Okay, after vaginal delivery, I mean after what? Vaginal delivery. Okay, how much blood are you going to lose? So vaginal delivery, it is acceptable for you to say that is PPH. It has to be greater than what? It has to be, let's say, it has to be what? Greater than what? It has to be greater than what? 500 mils. Okay, then you consider as PPH. Okay, but C-section has to be what? Has to be greater than what? 1000 mils. Okay, that is the first definition. So first definition, how can you put it? You can say, okay, bleeding after delivery, if it is for after vaginal delivery, someone has to lose at least greater than what? 500 mils. Or if it is C-section, it has to be what? Greater than 1000 what? Mils of what? Blood loss. Okay, that is the first definition. Okay, you can put like that. Yes, it is acceptable. Then another one. The other one that is really important is this one. So you say bleeding after delivery. Okay, either, so here you say either vaginal or C-section, and making a patient hemodynamically unstable. Okay, hemodynamically unstable. This one is also the very important definition. So after someone like they are bleeding after they deliver either vaginally or after C-section, but they are what? Hemodynamically unstable, or they are what? If they are hemodynamically unstable, basically they are having symptoms of what? Of that blood loss or hemorrhagic shock. Symptoms of what? Those. So basically that is the second definition that you need to understand. But there is also the third one. The third one, although it's not what used commonly, we are saying it has bleeding. That is what? Making the hemoglobin to be less than what? To be now less than what? To be less than 10%. Okay, to be less than what? 10% HB. So HB less than what? 10%. Okay, so that is also another definition. Okay, but this one they don't usually use it. The most common use, acceptable, is the second definition. Although the first definition is also important, so write at least 2 definitions so that you can get what, 4 marks for that. Okay. Now there's also another question. So we've answered this one. So we're saying, so define the condition. We're saying bleeding after either vaginal delivery or C-section. After vaginal delivery is what? Greater than 500 mils blood dose, or C-section greater than 1000 watt blood dose. Again, there's another definition: bleeding after delivery, either vaginal or C-section, but making this the patient to become what, hemodynamically unstable, showing what, symptoms for what, blood loss, or making the hemoglobin less than what, 10%, and a patient is going to be what, symptomatic. Okay. But this one is not commonly used. Okay, that is it. So now the question is, how can you classify it? So classify it. So the class. So the class of this one is what? So how can you classify this PPH? So PPH can be classified according to what? Duration. It can be classified according to what? Duration. According to duration, it can be what? Primary. Okay, primary what? PPH. Okay. Basically, primary PPH is going to happen in less than what? 24 hours, or within 24 hours. And the common cause of this is what? A tonic what? Uterus. Okay, uterine atomy. So a tonic what? Uterus. That's a common cause of what? Primary PPH. What is the second one? The second one is what? If there is primary, there will be what? Secondary what? PPH. And it has to happen between what? 24 hours and up to, others they use up to 6 weeks postpartum. Or maybe the maximum that we can put is what? Up to 12 weeks postpartum. Okay, that is secondary. The common cause of this is what? Tissue and what? Infection. Okay, that's the common cause of what? Secondary what? PPH. That is according to what? Duration. According to blood loss, so there is also another one according to what? Blood loss. So according to what? Blood loss. According to blood loss, amount of blood that is going to be lost. But this one is not common use. They common use this one according to duration, primary and secondary. Okay, but also you can classify according to blood loss. The blood loss, if it is less than what? 1 liter, then we are going to call it what? Minor. Okay. Then the second one is what? Then the second one is, if the blood loss is what? If the blood loss is between 1 to 2 liters, okay, between 1 to 2 liters. If this is minor, here it will be what? It will be moderate. Okay, so here minor, mild. Okay, so here it will be what? Moderate. Okay, then if the blood loss now is greater than now, if it is greater than what? 2 liters. 2 liters. If it is greater than what? 2 liters, we're going to say that it is now severe. Okay, severe type of what? PPH. So this is PPH, minor PPH. Okay, and then this is PPH, and this is PPH. Okay, this is how you can classify PPH according to duration and according to what? How much blood is lost. Less than 1 liter, between 1 liter to 2 liters, that is moderate. Severe, that is should be greater than what? 2 liters. So this is the second what? Answer. Okay, now we go to question C. So question C, list 4 signs that the patient might have when you examine her. Okay, what are those signs that you can see? So basically, this patient is what? Losing blood. So what are those signs that you can see? You can see now a lot. After examination, you can observe something. So here we've answered from this side. So here we're saying the signs that you can see. First of all, you can see tachycardia. Okay, a lot. You can see tachycardia, tachypnea. So tachypnea. Okay, what can you see? Cold extremities. So these are the signs for anemia, cold and clammy extremities. So a lot that you can see. Okay, increase in what? Increase in respiratory rate. Okay, increase in respiratory rate. A lot of what? Things, signs of hypertension, maybe mouth organ failure like that. Decrease in what? Urine output. Also look at the uterus is tender, lower abdominal tenderness like that, okay? A lot of signs that you can see after examination. The uterus is bulged and soft, signs of atomic uterus, one of the cause of PPH. So all those things you can see under the signs. So there are a lot of signs that you can see, okay? D. So these are the 4 most common causes of this patient condition. So what are the 4 common causes of PPH? What are those? So we use 4 T's, okay? So we use 4 T's, okay? We use what? 4 T's, okay? T number 1 stands for what? Tone. T number 1 stands for what? Tone. T number 2 stands for what? Tissue, okay? Tissue. T number 3 stands for what? Trauma. Okay. T number 4 now stands for what? Thrombosis. Let's just do this. Thrombosis. So to know more about what? These causes, okay? These causes, you need to watch PPH video. So there's a video for PPH. Make sure that you watch it so that you see a lot of a lot of explanation when it comes to maybe a tonic uterus. What are the causes of a tonic uterus, like multiple gestation, over distended uterus, use of magnesium sulfate, all those things, okay? We talked about that. The beta blockers, we talked about that, okay? So make sure that you go and watch that video. So but the most common causes of this is what? Tissue. So T stands for what? Tone. Basically, we're talking about a tonic uterus, okay? Here we're talking about a tonic uterus. Tissue, we're talking about some part of the placenta or some part of the conceptus, they are in the uterus, like that. So maybe part of the placenta there, it is left in the uterus, causing the excessive bleeding. Maybe need to check for accessory placental lobe, like that. Need to look at the placental disorders like eccrita, pecrita, increta, all those things, the under tissues. Trauma, we talked about laceration, the degrees of laceration, because they are very, very important, okay? From 1 to first degree up to 4th degree, we talked about that. Thrombosis, we talk about DIC. So which can lead to thrombosis, which can lead to DIC, okay? So we talked about that. So make sure that you watch that video. So these are the 4 most common causes of PPH. Let's go to E. They are saying now outline principles of management. So here you need to understand something. They are not saying that you need to specify the actual management. No, outline the. So what are the principles that are there that you need to follow for you to manage a patient correctly? So what are those? Okay, you need to say the first thing, since this PPH is always an emergency when it comes to what? When it comes to OBS and GYN, okay? PPH is what? An emergency. What are you supposed to do if this is an emergency? You always call for help, okay? But before calling for help, the most important thing that you need to do is what? Early recognition, okay? Early recognition. So early. So let's just say recall. Early recognition, that's the first principle that you need to do. So in the moment you just see blood, so you need to recognize that this is what PPH. Otherwise, if you don't recognize it earlier, the patient can die. So early recognition, one of the important principle. Okay, what else? So this is the first one. Now the second one, what did I say? After you recognize that, then you call what? Call for help. So let's just say for H, call for help. Number 3. What is the third principle now? If you call for help, you resuscitate by doing what? ABCs. You do that ABCs. Okay, you resuscitate. A lot you can do under airway, breathing, circulation. You do like you stabilize the patient. That's why maybe you can treatment of shock, because this patient are losing blood, okay? So you need to treat what? Shock as well. So this is under what? ABCs. You need to stabilize the patient, okay? Under here. Okay, then if you also monitoring, is quite alright to be under here, okay? But monitoring, after you stabilize the patient, you continue monitoring, okay? After also maybe doing something else as well, also continue monitoring, because monitoring is also important. We'll talk about that, okay? So, but generally, you do what? You stabilize the patient by doing what? The ABCs. What is the fourth principle? So after now the patient is stable, now what do you do now? You identify the what? The cause. Okay, identify the cause, because there are four causes, the four main causes there. You identify what? The cause. But the most common cause of PPH is what? We know that that is what? A tonic uterus. That's a far most common cause of what? A PPH. Okay. Okay, but although a tonic uterus is the one that can cause what? Primary PPH, but it's the most common cause of PPH in general. Okay, so you identify the cause. After identifying the cause, now you start doing medical management. Okay, medical management. You start doing what? Medical management by now simply doing what? You give oxytocin like that. Okay, you give oxytocin, egometrium. Okay, what else? You also do, you give prostaglandin like carboprost. You give them what? Prostaglandin like what else apart from that? There's also my misoprostol. You give them like that. Okay, stuffs like that you need to give them. So that is under medical management. Okay, after like maybe some medical management fails, then you can do something else, because they still bleed. They are still bleeding. Although you stabilize them, you identify the cause, then you start doing medical management like that. But they are still bleeding. What can you do now? There is now mechanical management. So you do mechanical. So let's just say number 5. Number 5 is what? Mechanical. Mechanical management. So you do mechanical management. Why doing mechanical management? Because you are going to intervene yourself. Okay, since blood is still coming, you're going to prevent the blood loss temporarily, so that now you can take them to OT. Okay, operating theater. You take them to OT. So you are going to do two main things under what? Mechanical management. What is that? Okay, I'll write it here. Two things we do. We do bimanual compression. So you can do bimanual compression. Bimanual compression, what do I mean? Basically, you just get your hand and you put it into the vagina. Then also you get the what? Your other hand on the what? You compress it against the what? The abdomen there. So in that way you can prevent what? The further blood loss, but temporarily, so that you can take them to what? Operation theater, in case they need what now? Surgery, because everything has what? Everything has failed. Like the medical management has what? Failed. What else can you do apart from this one, the bimanual compression? There is also another thing that you can do here. Okay, another thing that you can do is what? So what you can do, something is now there is what we call intrauterine what? Balloon tamponade. Okay, so we're going to say intrauterine balloon tamponade. Okay, intrauterine balloon tamponade. Okay, you can do that like that. Okay, so whereby you use the Foley's catheter, then you just insert like that. Okay, then you inflate the balloon there. So basically, the intrauterine balloon tamponade, what does it do? It just gives what? It gives what? What can I say? It's going to stimulate the uterus to start at least contracting, so that it can what? Prevent blood loss like that. Okay, that is under that. But we talk about the intrauterine balloon tamponade and how you can use it, how you can insert it in other videos like that. Okay. Now, since we've talked about that, then what is the other thing? Now, since this is the temporal management, then you take them to OT. So take them to what? OT. You take them to what? OT, operating theater, where you can do now surgery. So the last important thing is what? Surgical management. Okay, you take them to operating theater so that you can do now surgical management. So now, what are those surgical management that you can do? Okay, we know the first one is what? Bleeding. Okay, is this what we call bleeding? We'll talk about it as well. Bleeding, you can do it. Okay, you can do that. Internal iliac artery ligation. Okay, you can do this internal iliac artery ligation. Okay, also uterine artery ligation. So uterine artery ligation like that. So internal iliac artery ligation, and also uterine artery what? Ligation. Okay, you can do that. But the last thing that you can do is what? Hysterectomy. Hysterectomy. Okay, basically you just remove the whole uterus, because the uterus, the problem is the one that is making sure that there is bleeding. Okay, but that is the last option, because the hysterectomy is going to affect the fertility of the mother. Okay, that one. Now after you do this, now what do you do? The last principle now. What after you do all these things, the last principle is number 7. Number 7 now, you do what? Monitor. You monitor them after surgery or after medical management. Maybe if medical management was successful, then what are you supposed to do? You monitor them. You monitor the urine output. At least the goal should be what? Greater than what? 30 mils per hour. You monitor the blood pressure. You monitor about the what? Respiratory rate. You monitor the pulse rate. A lot of stuff that you can do so that you prevent what? Complication that they can have. Okay, those are the principles that you can follow. Okay, then let's go to this one. Mention 3 drugs that can be used in the management of this condition. Okay, what are the 3 drugs that you can do? The first drug is that you can do is what? You can give them oxytocin. So, but basically we talk about the dosage that you can give us that you can give to a patient having what PPH, like 10 international units of what oxytocin. If maybe blood persists, you can give them 40 international units like that. Okay, in 500 mils in normal saline like that. Okay, we'll talk about that. So, but the first drug that you can give is what? Oxytocin. Though it has been talked about there. Okay, I'm just saying oxytocin, but we'll talk about others. Okay, oxytocin, what does it do? Mechanism of action is just what? What does it do? It's going to stimulate what? Uterine contraction. If uterus contracts now, what's going to do now? It's going to prevent what? Blood loss. What else? We can give also prostaglandins. So you can give what? Prostaglandins. Okay, like what? PGF2 alpha. Okay, F2 alpha. So PGF2 alpha, which is what? Carboprost. So this one is a powerful prostaglandin that you can give. Okay, it also promotes what? Uterine contraction. What else? PGE1, which is what? We said this one should be now misoprostol. Okay, misoprostol. This one, okay, also promote what? Promote uterine contraction. Okay, what else apart from that? You can give also which we call this one, but okay, calcium gluconate. You can also give it because it's also promote what? Promote uterine contraction like that. But okay, we'll just give something else. We can give this one. We can just give this one. Tranexamic acid. So tranexamic acid is what? Tranexamic acid. So tranexamic acid, what is it? It is what? Antifibrolytic what? Drug, which is going to inhibit what? It's going to inhibit the plasminogen activation. Okay, it's going to inhibit that. That is tranexamic acid. So you can use that. You can also use another one, but it's not common use. This one, egometrin. Egometrin is not common use. Egometrin is not common use, and basically I need to know that it is contraindicated in what? Someone having hypertension, preeclampsia, like heart failure like that is going to be what? Contraindicated. Don't give it. Okay, egometrin is a powerful what? Uterine what? Stimulator. It's going to stimulate the uterus to start what? Contracting. It's also powerful. Okay, so basically these are the drugs that you can give someone with like that. Okay, someone having this. Okay, so this is where we end from, and make sure that you start more. All the best. Don't forget to subscribe and like the video.